I'm Dr. Pam.
I'm Nurse Rina. So I think a topic that we're going to talk about today is one that I'm getting from patients a lot lately, every week, if not twice a week, and it's about menopause. So I want to ask Dr. Pam about menopause, but really quick, a quick story of mine, why it interests me so, and I feel for the patient so much, is at 48 I had a surgical menopause where I had my ovaries, the tubes, and the uterus taken out, and was not informed about the hormone replacement that I might have needed. It kind of completely changed my personality, so it wasn't a fun time. So.
Yeah, because that's harder, actually. When you have your ovaries removed when they're still doing their thing, making estrogen and progesterone, and all of a sudden they're plucked out of you, you have a drastic drop, and it's harder than natural menopause. And so, yeah, we have to talk to patients about that if they're going to do it. And I always tell them, hey, it could be a little rough trying to work on things to get you to feel the right way.
What I think about it too is I really think it affected my personality so much that that's when I started to have issues in a marriage.
Yeah, because all the symptoms of menopause that we normally get, you're getting like all at once on steroids, right? So you're making these really good levels of hormones, and then you're making nothing. And so it's a big deal, but the symptoms are the same. I think they're just a little more dramatic for sure. And so by definition, menopause is not having periods anymore. As we use it as a definition. If you haven't had periods for a year, you're officially menopausal. And the ovaries just stop working unless you have them surgically removed like you did. So the ovaries just quit making estrogen and progesterone. And the brain hormone still sends a signal to the ovaries like, hey, ovaries, come on. And that's why if we are trying to measure if someone's in menopause or not, we can do blood work. We check for a hormone called follicle stimulating hormone, and it goes up if we're in menopause because it's going, come on, ovary, make estrogen, and the ovary's not responding. And so that level goes up, and that gives us an idea if we do blood work if someone's there or not. But when the ovaries quit working, they're not making estrogen, they're not making progesterone. Now they do continue to make testosterone, but when you have them removed, of course, you're losing that as well, which probably can make symptoms even worse. So the low estrogen levels will lead to some women, everyone's different. Some women cruise through it. Some women go totally psycho. I had a patient once who came in and she wasn't in menopause yet, but she was so afraid of it because she said when her mom was in menopause, she chased her dad with scissors and she thought her mom was going to kill her dad. So she was not wanting to have that same anger and rage. Dang. So, for some women, they get the biggest symptoms that most women get are the hot flashes and the night sweats and things like that. But definitely mood changes, more irritability, anger. Women are more emotional. On occasion, I would have a patient bring in her friend or sister or someone and say she won't stop crying, and they literally come into the office just nonstop crying. So mood is affected tremendously. There are higher rates of depression and anxiety in women around that time from the low estrogen. And then also, some women have fatigue. Some women have horrible muscle aches and joint pain and things like that, that can really affect quality of life. Other women, like I said, they have some symptoms here and there, but they do really well and they kind of cruise through it. So,
That's so good to know. It really is. I think that would give peace of mind if more doctors said what you just said.
Yeah.
Because you feel like you're going crazy.
Yeah. And before we hit menopause, where we officially don't have periods anymore, we go through perimenopause, and that means you get some of the symptoms still, but you're still getting periods. And that sometimes is a worse time for women because right before their periods, especially their estrogen levels just plunge down. They'll get the hot flashes, the night sweats, and the psycho moments that we've all had. I've had those too, where you overreact to something and you are, but at the same time you're so enraged and you can't help it. And then the next day you're like, oh my gosh, who was that?
I used to think it was like being drugged. I felt like someone did an IV and was putting a drug in because I felt like I had no control. Over the emotions.
Right.
And,
it's really scary. It's super creepy. And even our mom, who was pretty even keeled, when she went into menopause, the weirdest thing for her was she had horrible anxiety, and she never really had anxiety. And it was, this is a woman who traveled the world. She was Australian, all of a sudden she would like get in her car to go to the grocery store, and she would have so much anxiety she would just go right back into the house, right? Pretty dramatic. So, and for her, she had a hysterectomy, and I said, well, why don't you just try some estrogen and see if it will help? And she did, and the anxiety went away. And what was so fascinating was like maybe 4 years later, I go, hey, Mom, why don't you just go off of it and see how you feel, because eventually women usually can come off of the hormones if they decide to take them. And she would come off and say that anxiety came back, and then I go, ooh, go back on it again. And then it took 8 years, and I remember it was about 8 years that she came off and said, I feel fine. And what's funny is when I first finished training, they used to say that those horrible symptoms that some women get last 3 to 5 years, which I knew wasn't true because I had too many who weren't. Now it's 8 to 10 years.
Wow.
Then there are 15% of women who will forever be hot. Just the hot flashes.
I didn't get that, but I hear that a lot.
And so that can happen as well. But yeah, it can be a really rough time. And so if it's not in general, I think the biggest thing about menopause is that's the time you have to be at your best for wellness, for exercising.
You're exactly right.
And for stress.
Which is hard to do. You got to really push yourself because you don't feel like doing it.
Right.
It's like.
Yeah. And your sleep's affected. So a lot of women in menopause have insomnia. That's a huge thing.
That's me too.
And then one thing I didn't mention before, but our cortisol levels, cortisol is a stress hormone, naturally go up when we hit menopause. And cortisol can raise blood sugars, and that's why a lot of women get that nice truncal fat, because the estrogen kind of keeps us in that curvy women fat, and then the higher levels of cortisol with the lower levels of estrogen or no estrogen make you put down truncal fat. That's what cortisol does. It's designed to protect you if you're in danger, makes you have that little fat cushion, and then it also has blood sugar ready for you to be able to run away. And so that happens. And so for sure, I think women need to pick up the fitness if they're not. And you have always told me that I have to do weights.
You have to lift weights. You need resistance training.
We
need that muscle mass.
I like the cardio. I don't like doing weights. So I finally hired a trainer to make me do them the right way and to make me do them more than anything. But we have to we lose muscle. We do lose muscle with aging in general.
Well, they say 30, but I kind of don't like that statistic because then that puts it in your brain. Oh, at 30. But,
Yeah. So,
you do lose.
But you can keep it up. You can. You just have to put the effort out there. And then if you exercise, that's going to help you with some of the other emotional things as well, because it helps you with anxiety. And exercise is a known treatment for depression. They did a study once where they compared walking every day to taking Prozac or doing both, and they found there was no difference between the walkers and the Prozac people.
I heard walking did better.
Yeah, it probably did because it gets you outside. It makes a huge difference with anxiety. So exercise, and then I will talk another topic because it was such a huge issue for me, anxiety. And meditation. I think if you're having that horrible anxiety, if you decide to do hormones or not, which we should do.
That will be a topic.
Yeah, because that's a big issue. Who needs hormones? Who doesn't need hormones? What are the risks? Blah, blah, blah. But so for me, that meditation every day made a huge difference. And then the main reason I did it though was, meditation lowers heart attack and stroke risk. And we kick into that once we hit menopause. Before menopause, women have a lower heart attack and stroke risk compared to men because that estrogen is protective. And then when we hit menopause, we start to equal them. So, things like that. And of course, you have to eat, you can't eat a bunch of sugary, processed, crappy food because menopause will bring out any weaknesses you have, really. And so this is the time. And then if you're doing all these great things and you're still not feeling better, well, then there are hormone options and non-hormonal options that we can.
And everybody's so different because I felt like I tried everything. I tried the pill. It made me sick. Creams didn't work. So you really need a doctor that works with you.
Yeah.
Right? Works with.
That is so true. Every woman is so different. And what works for her friend may not work for her.
That's exactly right.
And So, so menopause in general is just that low estrogen state, higher cortisol state. And it is a time when you're, especially when you're perimenopausal, which is in your 40s usually, women will start having those symptoms around mid-40s, sometimes earlier, closer to 40. And the average age of menopause is about 51 to 52, somewhere in there. But some women go longer. Some women go sooner.
I've heard funny things like, I'm curious if this is true, where all of a sudden you feel like you get a bug bite, like a thing on your legs. And I heard that's related to menopause.
Like little neurological things, you mean?
And it feels like like a spider just bit you.
Yeah, you think that's not a super common one, but I think what it does is menopause will bring out some weaknesses that you already have. Like if you already have some little nerve things, it will exaggerate it. Wow. And if you have any disease states, like let's say if you're a lupus person or someone like that, sometimes those symptoms will make it easier for you to have like a lupus flare and things like that. So that could be, right? Okay. It's not a very common one for sure.
Right. But I kind of laughed when I heard it because I get that. I'll go, I swear a spider just bit me.
Yeah.
Of course not. I'm just standing there doing laundry kind of a thing. So
yeah. Or just, you're a little bit.
No, that too.
But so symptoms like, for some women are going to be very different than they are for other women.
Yeah. Love it. Love that info. I really hope you share that information. I think it's just not discussed enough.
Mm-hmm. Right? Oh, and I forgot to talk about the loss of libido. That happens.
Oh, and that will be a topic
That's a pretty universal. Now, supposedly someone did a study and said that women lose 20% of their libido, which I don't know how they put a number on it, but there's a drop because of the hormone drop. And then,
I'm surprised it's only 20%.
Yeah, that's what I mean.
Like so many women.
It seems to be higher because most women are, we're stress affected for our sex drive.
That's true, too.
But when we start getting the dried out vaginas that hurt, and women will describe it feeling like, glass. Sandpaper. Not very fun with intercourse and things like that. Then that's an issue too.
But that can be helped, by the way.
Right. There's a lot to do for that.
There is. It's great. That along with, to me, the bladder issue, which is that due to the low estrogen?
Yeah, so what women don't realize is the bladder sits right above the vagina. And so when we, like, let's say we gave a woman vaginal estrogen to help with the dryness, it also helps support her bladder tissue. It thickens the tissue in the vagina and the bladder. It makes it thicker and more pliable again like it used to be. So that is a big deal. So low estrogen will make women sometimes have more leaking or more urgency or frequency of urination. And so,
like kind of what I had. That's why I love talking about that. The cream just makes me even have a stream, believe it or not.
Yeah, it makes a big difference.
Big difference
because it's thickening that same the bladder tissue just as much as the vaginal tissue and making it function more normally again. and be more protective. They also, women who get a lot of frequent bladder infections, they did a big study in women who were pretty elderly, like in their 80s, who had frequent bladder infections. And when they used the vaginal estrogen, they found that they had like an 86% reduction in urinary tract infections. So super effective, right? And you don't think of that when you think of treatments.
That's right.
And also, there are different things you can use to treat the vagina. And the one thing I think that is tricky is that when I give women vaginal estrogen, the package insert, the warnings is they're the same warnings they give for the pills. But it's so different because when you're putting it vaginally, there's not a lot of systemic absorption into your bloodstream. So it's not the same risk factor. So, for example, we can safely use vaginal estrogen in women who have breast cancer. It's not your first choice.
I'm so glad you said that because there's women that our doctors will say, you know what, you already do this, you can't get the cream.
Right.
And you can't insert even into the vagina if you take a regular type of...
Oh, yeah. But even I have women, that's their only complaint. So why would I give her something systemic that has some risk factors when I could just treat her vagina and not give her any risk? It doesn't increase risk for uterine cancer. It doesn't increase risk for breast cancer. It's more of a local...
Guys. Sure.
Yeah, it's a local treatment, so it's very, very safe. Now, you have to take it the way it's directed. You can't just, if you put a tube of cream up there, you'll get a lot of absorption. So you have to take it as directed. And, but yeah, so I think that women are afraid to do it. Sometimes it's not the same as doing hormone replacement. And like you said, let's say you choose to do estrogen replacement, like I do a little estrogen patch. Well, sometimes it's not enough to give you vaginal benefit at all.
It didn't for me.
Right.
Nope.
So that's the thing. So some women will have to do both. They have to do both.
I do both.
Yeah. To keep things functioning. And some women never need anything. That's pretty rare, though. It's pretty rare.
Why you need a doctor that actually treats you individually.
Yeah.
It's so important.
Yes. And there are some newer products now for the vaginal dryness as well. Yeah. So.
But I always make a joke too sometimes with the patients, things like if men went through menopause, we'd have cures already, things like that.
Well, and I give my patients a choice. If they're having a lot of pain with intercourse, I say you have a choice. You can either get rid of your husband or you can try to treat it.
Or let them have a
And
mistress.
You know what? Some of them have to really think about it. Well, should we go into any of the products at all, do you think? Or nah?
That's up to you. I don't know.
Should we do that another time with hormone if we talk about that's a huge topic, hormone replacement.
I think that will be another topic.
So we could talk about different things.
Because this is an expert here, by the way.
So we could go through some of the different products you can use. We'll do that another time.
I guess in the meantime, please know you're normal and, tell the doctor your symptoms and treat what's happening now. Really know that. Yeah.
Yeah. When I first came out of training, they told us that anxiety and depression were not related to menopause, but I learned very quickly that was a big lie.
Yes, right.
And then finally they came out and studied it when they were looking at women who were newly menopausal, and they did some better studies. They found that was a very huge issue. Very huge issue.
That out.
And the one funny thing I think is most women, when they're perimenopausal, like they're mid-40s, and they start to get the hormone fluctuations and they start to get like severe symptoms, especially before their period, and they feel like they're psycho, usually coincides when they have teenagers. So I always think maybe it's nature's way of, how we just love our kids so much and we want them to not leave,
let them
to make
separate
them
a little bit.
You need to get out of here. You need to get out of here. But especially if you have girls going through some hormone issues at the same time, teenage girls. But and I think it is a time when some women because they get a little bit angry, start to stick up for themselves. So sometimes it results in some good things. Like, one of my patients, when her husband asked her to get the glass of water when he was sitting on the couch, she finally looked at him and said, "You get it yourself. I'm not doing it." Just things like that.
Yeah,
that's good. But it can be, I think it can be really rough sometimes, like what you went through when you had the ovaries plucked and your levels plunged.
And not talked. I wasn't talked to about it was the problem.
It can cause marital issues, or even lots of women will say even at work they're not the same, and people start to just say, "What is wrong with you?" And that's not a good feeling.
But I wonder if they did actually a study that showed divorces.
I know.
And women that are peri or going into menopause, if there's not a statistic.
Yeah.
I think there would be, to be honest with you.
Yeah, I would think so too, because it's already hard enough if you have everything is working out okay. It's still hard. So if you have any conflict at all, it will be exaggerated. And it can be bad.
Yeah. I was loony.
Yeah.
A little loony.
Yeah.
But you helped me. Thank goodness I was even asking back then.
Yeah.
Because...
Yeah, but there are a lot of options, and not just hormones, other things. But it is the time when you have to change your evil ways. If you're eating just crap and you know it, and you're not taking care of yourself, you cannot do that anymore. Right. That's number one. And then if women are still having issues after that, you can talk about hormones and things like that.
Well, I think such a good point. And I think, again, the solution is hearing this information from the doctor, so you're normal, and maybe you have to put that extra effort, Mel Robbins 5, 4, 3, 2, 1, get up and go kind of a thing. Know that you may have to do that. I think really helps people.
Yeah.
Hey, I'm normal. This is okay.
Right.
And do what you have to do.
Yeah. And for me, my biggest symptoms were, but I went slowly. I didn't do the plucky. It was really fatigue and joint pain. And you're like, whoa, I feel like I'm 90 years old.
Right. See, they don't talk about that stuff. People are going to go have fibromyalgia.
Yeah.
They don't.
And I think our little sister, she had surgical menopause earlier too, I think. Anyways, she would get those symptoms, I remember. She would just say, "I'm just exhausted," and I ache all over.
Yeah, fatigue.
And those were her main ones too. But everybody's different. And the other thing is, hot flashes are weird. They usually are. They kind of start in your chest and then they flush up. But I notice a lot of patients get little heart palpitations with it, or little heart things, and then that freaks them out. Right. So then once you go, "Oh my God, what's wrong?" You get that burst of epinephrine, norepinephrine, and cortisol. So then it makes your heart rate even go faster. And what that is most of the time when I've sent women who notice that a lot, they just are having more PVCs, or premature ventricular contractions, which are okay. They're not bad. They're normal. We all have them, but they'll exaggerate sometimes with hot flashes or menopause. And people don't talk about that either. And that's scary. Don't. And so some women, when they get that flush, will get that same.
So what can they do at that? Like, again, other than go, "You know what, it's normal. I'm okay." What else? What is there anything immediate you can do for that at all?
When you get the heart racing thing? Well, number one, knowing that happens, so you don't freak out and think you're having a heart attack. And then, of course, any stopping and doing like some deep breathing, the belly breathing thing. Because belly breathing is when you inhale, you really should be, your belly should move out as you inhale. Most of us do shallow breathing. And then when you do that belly breathing, the deep breathing, and your belly moves out, and then as you exhale, you try to let everything go. Your brain goes, "Oh, she's not in danger," because you want, if someone's chasing you with an axe, you're not going to go, "Excuse me, wait." So that your brain knows you're not in danger. So then it'll kick you out of that flood of epinephrine, norepinephrine. So that's one trick. Some people.
You hear the things about the natural, like, I swear, if I take the black
cohosh.
Well, yeah, I don't know. The
Yeah,
names,
and
but
black
What do you
cohosh.
think of those?
Yeah, some of those have some data. Black cohosh, the most common form is in Remifemin, the brand. It's funny because, when you compare a lot of menopausal drugs to placebo, they're not always very good.
Yes.
So if you like placebo, in a regular study, a double-blinded randomized study, what happens is half the people get the placebo, which is a nothing pill or patch or whatever you're studying, and the other half will get the actual drug, and it's supposed to be blinded to the people giving it out. So what's so fascinating that is in general placebo benefit, like the people taking the placebo will have benefit. A minimal of 30% of them will have benefit.
I know I've heard as high as 40.
Oh, it goes, and menopausal studies is at least 40%.
Wow.
And then here's the thing, if you really believe in the person who's like, hey, try this product, it's amazing,
Yes.
it goes up even higher for placebo benefit. So I think it's so fascinating.
Well, I love
menopause.
that. I mean, I'm like, if you think it's going to work,
yeah.
take it.
So black cohosh has been studied in some double-blinded randomized studies, and in some studies it was better than placebo, and in other studies it was not. So it's kind of hard to say. They did a really good one with breast cancer patients, because breast cancer patients in general are not going to take systemic hormones. And it didn't turn out as great as we wanted it to. It was more like just placebo effect. Does it hurt? Is it harmful? No.
Right.
And some women, like I said, if you're getting benefit from it and it's not harmful, why not?
It's not going to hurt.
Right.
Sure.
So some of those medicines, and I think some of my patients have done like Chinese, herbal things before, and some of those have some data like ginseng and ginkgo biloba that can help some of the symptoms a little bit, without really causing harm. And then, of course, a lot of women, by the time they come to me, honestly, have tried most of the over-the-counter things. And so then I have to talk to them about whether or not they're a candidate to try hormones. And it's all about quality of life, right? Some women, they just don't need it. And other women, their quality of life is so terrible, they'll do anything, right? So they will want to do hormones. I mean, back in the day before they figured out how to get estrogen, which, the original product was estrogen from pregnant mare's urine, which was Premarin. It came from pregnant mares. That was the first time they were able to extract estrogen for women to be able to take. Wow. And it was a huge thing. Before that, when women were doing crazy things like they grind up like pig ovaries and try to eat them and do all these weird things because those severe symptomatic women really were desperate. And so that was a huge breakthrough. And then now we can safely extract estrogen from plants.
So the craziness, so back in the day, they used to think women that were going through were crazy. Right?
They would commit. The men would often put their wives in an asylum because they thought they were psycho crazy. And we had nothing. So, it's a big deal. It's a big deal.
I like that it's being talked about. I love that the patients are asking.
So now most of the estrogen products besides Premarin come from plants.
That's good to know. People always are like, is it natural, organic, and all that stuff?
And it's really not super natural, even though it comes from a plant, because they still have to treat the plants with chemical agents to try to extract it.
What about the ones that when you go to the office and you have to pay extra, and they go, ours is
bioidentical.
Yes.
Bioidentical.
What is? Well, I guess that will be another topic.
Yeah, because bioidentical, and honestly, most products these days are bioidentical, and almost everything comes from plants, really, except for the Premarin, which comes from the pregnant mare's urine. But So when we really get into that hormone, because that is a big discussion, because again,
that's life.
That's everyone has different risk factors for hormones. Some women really don't have any, and others do, and it's based on kind of lifestyle, really. So
and back to lifestyle, that made me think about weightlifting, because that will be a big time topic.
Yes. Yes.
We're going to talk about that.
What do you think? Well, let me ask you about that. So for the muscle loss that we get as we get older, what about Pilates and yoga and things like that?
I love any movement. Any movement is better than no movement for sure.
But that's like body weight type.
It is, and that's pretty good. I am, though, a fan of, they'll always go, I always think about back in the day in the farms, and they're pushing the wags and they're lifting up the hay. That's weight, right? I'll hear kind of things like, we don't need to. I think we do. I think we do have to build that muscle tissue.
Oh, we do.
So I like Pilates. I do. But I think you do need to add some resistance where you reach fatigue of that muscle to make the changes in that tissue. So we have to push it to that point.
And what I like too is remember too, if your muscles are strong, your knees will work better, right? It helps your joints too, for sure. And that's a huge issue for a lot of people. Yeah. And then what I really love is that when I go to lift my suitcase up and put it in the overhead compartment, no problem.
Absolutely.
Heavy groceries. We should.
And you know what, to be honest with you, and this is going to be another great topic I can't wait to talk about, is aging. I'm sorry, if you're 60, 70, yes, you can 80. Lift your suitcase and put it up.
Yes, you can.
You just work out.
Yeah. That's true.
But that will be another topic for sure.
Yeah, that's a biggie. Yeah. Because a lot of people think, oh, I can't do that anymore. Find a way to do it.
It really makes me, really perturbs me, to be honest with you.
Yeah.
We got to change it. Society, I know why we think that way. Society is really ingrained in us how we're supposed to age. I can't wait to talk about how that is not true.
Yeah.
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 So, sorry, yes, Pilates, great. They're moving. It's awesome. Even talking to other women, wonderful, social. Hey, I'm going through this. Women can relate. And, that's really good.
Right.
But if they can, resistance training at least twice a week.
Yeah. So
walking every day, I guess, has so many benefits for everything.
Huge benefit for depression, anxiety, cardiovascular fitness for sure. It's a big deal for that too.
Yeah. So even just walk.
Cancer risks. They've studied it for breast cancer.
So we'll talk about that too.
Yeah.
There's so much we're going to talk about.
But yeah, so menopause, like we talked about, for some women it's easy. For some women it's very difficult. Yeah. And then those are the ones who usually will try things and then sometimes end up on hormones, which we'll do completely. Maybe we'll do it next time. So there's a little continuity for women who are like, well, what do I need them? Should I take them or not?
I don't know why people are so fearful.
Because of the Women's Health Initiative, that big study came out.
Wasn't that the one with the nurses?
No, Nurses' Health Study actually was very promoted estrogen. And we'll talk about that because that's fascinating. Because when I came out of residency, everyone needed hormones to protect their heart, and then Women's Health Initiative came along and destroyed that. So
I wonder why.
Yeah, so we'll talk about that next time, I think.
Yeah. Sounds good.
Yep.
So I really thank you.
Yeah.
I love this information.
Yes.
I really hope you share this. I really do. Women just feel like they're losing it, and they need to know this.
Yeah. Yes. Until next time.
Yeah.
Thanks for joining us.
Yes. Thanks.